With the coronavirus pandemic changing our lives, impacting the way we live and work, Dr Dean Eggitt, a general practitioner, describes how it's changed a GP surgery and what it will mean for going to the doctors in future.
There appears to be this preconception that GPs have closed their doors and pretty much stopped access to the NHS and stopped working, and I can't think of anything much more opposite really. Over the past few months, GPs have absolutely transformed their services and what we look like. And for those of you who haven't been in contact with your GP regularly or recently, will probably find the service unrecognisable compared to what it was. So you think of the old days of you phone up a receptionist, you book an appointment, you drive to the GP surgery, you turn up and you see them face to face. And actually the system has been revolutionised now, that most of our consultations are done over the telephone or done over a webcam interface or even a smartphone interface. So most people are not expected to go into their GP surgeries. We will do a prescription for you to any pharmacy that you like in the United Kingdom, and we will send that electronically. The way general practice has changed is going to be permanent. And I would be very saddened if my colleagues reverted to old ways of working. I can't really see a great deal of advantage in that, especially just thinking that COVID is here to stay. It's not going to go away in the next few weeks or few months. So at the very least, we have to practice like this just because COVID is still around.
Dr Dean says the country needs to be proactive because this prolonged coronavirus pandemic will have severe consequences for our mental health.
It's ridiculously important for us to recognise the mental health impact of this. In terms of the mental health burden, you can see then that the disease itself causes a mental health burden, the stresses of living like this causes a mental health burden, and then as our economy starts to deteriorate, which it will, it's going to have a big mental health problem. So people need to start first aid on this straight away. We really do need to start looking after our mental health.